So, our topic tonight will be about strokes, and our general purpose will be to educate about strokes. Our specific purpose will be to teach the specifics of strokes, and our central idea is strokes need to be talked about more for preparation and prevention. Just the term stroke strikes fear in the hearts of most of us. The idea of paralysis, even up to death, is terrifying. With a classroom that is this diverse, there is bound to be a number of people who have either had a stroke, had a family member that had a stroke, or a friend. And so most people are aware of the hardships that are included with the stroke. In 2014, I woke up from having what was supposed to be a very, very easy procedure. They went in to see if I had a blockage in my heart. And when I woke up, I could not move my right hand. I started crying, and my husband came over to the bed and held my hand, which dropped limply, and he ran out of the room to go get help. When I woke up, I was in intensive care, and I was being woken up so I could speak with the doctor via teledoc, who was a neurologist who was informing me that I had had a stroke, he thought. After months of both physical and speech therapy, I made a complete recovery, and I've always been very thankful for this opportunity. Strokes are preventable. We're going to talk tonight about what to do if you think you might be having a stroke, and yes, you can recover from a stroke, but let's talk about the stroke. I mean, what is a stroke? Well, it's also known as a CVA, which is a cerebral vascular accident. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or it bursts. There are three types of stroke. There's ischemic, hemorrhagic, and transient. An ischemic stroke happens when an area of the brain becomes blocked by a blood clot. Approximately 80 of 100 strokes are the ischemic. A hemorrhagic stroke occurs when an artery in the brain leaks or ruptures, and a transient ischemic attack is a warning, or it's more of a mini stroke. Stroke is the third leading cause of death and the first cause of disability worldwide. Every year, 15 million people have a stroke, and 6 million people do not survive. So it leads us to the question, what can I do to prevent having a stroke? Well, Dr. Natalie Ross states that knowledge is power. She is Associate Professor of Neurology at the Harvard Medical School, Harvard Health Publishing, page 1, published in June of 2019. She states if you know you have a particular risk that is sabotaging your health, you can take steps to alleviate that risk. The most important being lower your blood pressure. High blood pressure doubles your risk of a stroke. Your ideal goal for your blood pressure is 135/85. Aim for that. Lose weight. Exercise more. Don't drink alcohol, but if you do, do so in moderation. Treat diabetes. Quit smoking and vaping. Along with a healthy diet and regular exercising, stopping smoking is one of the most powerful tools to help you reduce your risk of stroke, per Dr. Ross. Now, this is our internal summary, and now that we've discussed what a stroke is and how to prevent having one, let's turn our attention to what are the symptoms of a stroke. Now, how do I know if I'm having a stroke? It's important to note that the symptoms of a stroke are not associated with any pain. If you think you're having a stroke, the following are classic symptoms that you should look for, and these happen suddenly. Difficulty seeing through one or both eyes, drooping or numbness on one side of the face, trouble walking or maintaining balance, and trouble speaking or understanding. The American Stroke Association came up with this easy-to-remember acronym called FAST. This is under stroke symptoms under the American Stroke Association 1. Use the letters FAST to spot stroke signals and know when to call 911. F is for face drooping, A is for arm weakness, S is for slurred speech, and if the answer is yes to any of these, T is for time, and it is time to call 911. So, the next question is, can a person recover from a stroke? Recovery after a stroke is different for everyone. Recovery can take weeks, months, and for some years, but it really begins a day or two after your stroke and while you are still in the hospital. The duration of your rehabilitation depends on the severity of your stroke. Your options for where this will continue can be inpatient rehabilitation units, skilled nursing facilities, and home-based programs. Depending on what was affected in your stroke, you may need to see a physical therapist, a speech therapist, or an occupational therapist, or a combination of all three. According to the Stroke Association, 10% of all people who have a stroke recover completely. 25% recover with minor impairments. 40% experience moderate to severe impairments that require special care in a facility setting. So, in conclusion, I cannot emphasize enough the importance of getting help immediately if you suspect you're having a stroke. Time is of the essence, as the best recovery is when you're seen by a doctor within 3 hours of your symptoms onset. You can recover from a stroke, but tonight you've been given information to avoid one. I very much like the quote from Kate Allett, stroke survivor. Start thinking wellness, not illness. Thank you for your time.